This project being announced was accomplished with the support, guidance, and influence of many people. And I'm just delighted that you are all here because I want to thank you, and I want you all to know how much I value your leadership, your wisdom, and your experience in child intervention, because I've had the opportunity to learn that firsthand as a minister over the past year. And like with today, when I saw you all coming off the elevator, just gives your heart a good feeling, doesn't it, to get together even as a group here today. Now, I'm going to ask that we have, here, I'll put this here. Oh, there, it's on. That's better. Can you hear me better now? Okay, thank you. I'm going to ask that our steering committee stand for special recognition. So we have Bonnie Johnson. Bonnie, if you'd stand, and just stay standing so we can just recognize you. And Joni Morrison O'Hara. Joni? Oh, Joni, come up here and by Bonnie. You can come up and sit. Come up here. Yes, absolutely. And we have Lori Blahitka. Lori, stand. And Donna Wallace. Donna. And our advisor, Dr. John Pierce. John. And also Inspector Steve Barlow. Inspector, come and sit up here, Inspector. That's just great. Anyhow, let's give them all a big hand. This has been an amazing, amazing group of people. We know that having a baby and struggling to balance work, family, and life overall can change people in ways that nothing else could. And once a family has a baby, their child is a part of their lives 24 hours a day in ways that no one can explain until it happens. And many are not prepared. And that's why we're here today, because those that aren't prepared especially can be families that are facing complex issues like addictions, mental health, family violence, and poverty. For these families, the responsibility of caring for their infant is really very overwhelming. And 6 months ago, I began to see increasing reports of infants who are at risk of harm due to neglect and abuse coming to the attention of our frontline staff. Many of you here know that firsthand. We've now completed a 10-month review of our files for infants under the age of 3 months who had come to the attention of our CFSA, Bonnie. We learned that an average of 35 to 40 infants a month has now increased to 50 to 55 infants a month. Often a call will come from a physician. It's usually a healthcare worker, like a physician, a social worker, or a nurse who's working in the maternity unit in the hospital or working in public health in a unit there, that raise concerns about the ability of the parents to care for their infant. 60% of the referrals come from the health community, primarily, as I said, hospitals and public health. 15% come from the Calgary Police Services. And after they've responded to an incident where the safety of infants was threatened. And our Deputy Chief here today knows that firsthand too. When I discussed this alarming trend with Ministers Wazdeski and Minister Oberle and asked if they would work with me to address it, they were immediately supportive. And a partnership was quickly developed between our Calgary area CFSA, our public health, and our Calgary Police Service. And today I'm just so pleased that you're all here, because you're here as a part of this announcement and joining me with this announcement, because this isn't about, as our Deputy Minister so clearly said all along the way, this isn't about us, this is about you. This came about because you've led the way by example, as I said earlier, and this is what today is about. So I'm pleased that you're here today for this announcement. That $1 million will be dedicated to establishing an Alberta Vulnerable Infant Response Team known as AVIRT, and that team will begin here in Calgary. By the end of April, which is pretty quick, by the end of April, we're going to have 4 CFSA caseworkers, 4 public health nurses, and 1 Calgary police officer working together in one facility, in one place, who will respond to these number of calls that we're receiving, and they'll respond quickly. And I'm understanding that the shifts will be, I think, approximately 12-hour shifts. People will be on call, Bonnie. You're arranging that operational, side of it with public health, with Lori, and with our police services. Now, this critical response team, they will assess the family's risk. They're going to work with them intensively, your teams, and until our newborns reach 3 months of age. This is the first time in Canada that an integrated approach will be used to provide immediate resources and supports for the well-being and the safety of our newborns. We know, all of us here know this, that it is vital that new at-risk parents get the assistance they need, but that they get that assistance early on. Safety plans, parenting plans will be developed, and families will be connected with ongoing supports in their communities, and that's critical to this program. Over these 3 months, resources are put in place, and parenting skills are going to be taught. They're going to be both physical and emotional, caring for the new baby, and importantly, the mom is going to be taught as well to care for herself, and the dad too. It's about the family as a unit. The team will provide intensive guidance. It's going to be intensive guidance and support all along the way. After the infant is 3 months, the families are not going to be left on their own. You've assured me of that, and I appreciate that you've taken care of that, the next step. I understand they're not going to be left on their own, that they'll be transitioned into less intensive support, but still support within the community with the right resources and services as well. And what we learn from this model that we've developed here in Calgary, what we've learned here, we're going to take that and move it north to Edmonton in August. So we have a few months to just work very quickly to get this up and running, so we have solid evidence, solid statistics, solid information into how we've assisted these young infants, as I said, between 0 and 3 months of age, and their families. Now, in closing, I'd like to thank Alberta Health Services. They have been awesome in contributing over half of the half of the $1 million funding for our Alberta Vulnerable Infant Response Team. And I'd also like to thank the Calgary Police Services for dedicating a full-time constable to the team. That is so appreciated, because these communication gaps that had been in place before, the communication gaps between our staff caseworkers and between public health staff and the nurses, and between the police services, those gaps in communication, parents often give different information to each group, but this intensive support is just going to create such strength for them, and that's what this is all about. I can't tell you enough, really truly, about how much my Deputy Minister, Steve MacDonald, and I appreciate the good work that you have done. And it's more than good work. It's really that you've picked up families and picked up the babies, and you're holding them close, and you're going to give them that intensive support that they need, and you're the ones who know at your fingertips what the right resources and the supports are that they need, and I appreciate it immensely. So thank you all. I'm going to